Hello and welcome back. I am Dr. Alan, and today we are exploring one of the most serious and fast acting infections in modern medicine meningitis. This condition can become life threatening within hours if left untreated. But with early recognition, timely care, and preventive strategies, the outcome can dramatically improve. In this video, you will learn what meningitis is, what causes it, how it spreads, the signs to watch for, and most importantly, how to protect yourself and your loved ones. Meningitis refers to the inflammation of the meninges, the protective membranes that surround the brain and spinal cord. When these membranes become infected, they swell, putting pressure on the brain. This inflammation can be caused by viruses, bacteria, fungi, or even non infectious conditions like autoimmune diseases or cancer. It is not just a headache, it is a medical emergency. Meningitis has been documented for centuries. Hippocrates described similar illnesses in the ancient Greece. The first major progress came with the discovery of the bacterial cause and the development of antibiotics in the 20th century. Despite medical advances, meningitis continues to be a global health challenge, with over 2.5 million cases reported annually and hundreds of thousands of deaths, particularly in regions with limited access to vaccines and healthcare. There are five primary types of meningitis. The first one is the bacterial meningitis. The most dangerous, can cause death or brain damage if left untreated. Second one is the viral meningitis. More common, usually less rare. Third one is the fungal meningitis. It is rare and seen in people with weakened immune systems. Fourth one is the parasitic meningitis. Extremely rare and typically fatal. Fifth one is the non-infectious meningitis. It is caused by cancer, medications, or autoimmune disorders. Each type has a different cause, progression, and treatment approach. The most common bacterial agents include Neisseria meningitidis, Streptococcus pneumonia, Haemophilus influenza type B, and Listeria monocytogenes. For viral cases, the most frequent are enteroviruses, herpes simplex virus, mumps and measles viruses, and HIV. Fungal meningitis, often due to Cryptococcus neoformans, usually affect those with suppressed immunity, like cancer or transplant patients. Meningitis causing organisms spread through different routes. First one is the respiratory droplets from coughing, sneezing, or close contact. Second one is the bloodstream infections traveling to the brain. And the third one is the direct spread from the nearby infections like an ear infection, sinus infection, or skull fracture. Close living environments such as dormitories or military barracks increase the risk of rapid transmission. The incubation period can vary depending on the cause. For viral meningitis, symptoms may appear within 3 to 7 days. For bacterial meningitis, symptoms can develop rapidly within 24 hours. Fungal and parasitic types may take longer, sometimes weeks. The faster the symptoms appear, the more urgent the situation tends to be. The classic symptoms of meningitis include high fever, severe headache, and stiff neck. Other symptoms to watch for nausea and vomiting, sensitivity to light, confusion or difficulty concentrating, drowsiness or difficulty waking, seizures, skin rash, particularly in meningococcal meningitis. In infants, bulging soft spot or poor feeding. These symptoms can escalate quickly, especially in bacterial meningitis. When not treated in time, meningitis can result in serious and sometimes permanent damage. Common complications include hearing loss, one of the most frequent long term effects, seizures or epilepsy, hydrocephalus, build up of fluid in the brain, learning disabilities or cognitive delays, paralysis or motor deficits, organ failure and death, especially in bacterial forms. Prompt medical intervention can significantly reduce these risks. Meningitis is diagnosed based on clinical signs and laboratory tests. The gold standard test is the lumbar puncture or spinal tap, used to collect and analyze cerebral spinal fluid. Key findings in CSF bacterial, high white blood cells, low glucose, and high protein. Viral meningitis, high lymphocytes and normal glucose. Fungal meningitis, elevated protein and low glucose. and slower progression. Additional tests may include blood culture, CT scan, or PCR tests to identify the exact pathogen. Now, let's go over a simplified comparison of cerebrospinal fluid or CSF findings in three main types of meningitis. This analysis helps doctors quickly identify the likely cause of the infection and begin the correct treatment. Let's break it down. First, bacterial meningitis. In bacterial meningitis, the white blood cells count is high, particularly a type of white cell called polymorphonuclear cells or PMNs. The glucose level in the CSF is low. This happens because bacteria consume glucose, and the protein level is high due to inflammation and leakage of proteins into the fluid. Next, viral meningitis. Here, the white blood cells are also elevated, but this time they are mostly lymphocytes, which are common in viral infections. The glucose level remains normal because viruses do not feed on glucose. The protein may be slightly elevated, but not to the extent seen in bacterial cases. Finally, fungal meningitis. In fungal infections, the white cell count is moderately high, somewhere between viral and bacterial levels. The glucose level is low, just like in bacterial meningitis. Because fungi also use up the sugar in CSF, the protein level is high, again due to the ongoing inflammation in the brain and spinal cord. This pattern of WBC count, glucose, and protein in the CSF act like a diagnostic fingerprint. It helps healthcare providers rapidly narrow down the type of meningitis and start targeted treatment, often within hours. Bacterial meningitis requires immediate hospitalization and IV antibiotics, often ceftriaxone or vancomycin. Steroids like dexamethasone may be added to reduce brain swelling. Viral meningitis is usually self-limiting. Treatment focus on rest, fluids, and pain relief. Antivirals like acyclovir are given if herpes virus is suspected. Fungal meningitis is treated with powerful antifungal medications like amphotericin B, typically for weeks. Supportive care is essential in all cases, managing fever, seizures, and hydration. The prognosis depends on the cause of meningitis, the patient's age and immune status, and how quickly treatment begins. Viral meningitis has a good outlook in most cases. Bacterial meningitis, if untreated, has a high fatality rate. Even with treatment, survivors may experience lasting effects. Early intervention saves lives and prevent complications. The best protection is prevention. Key strategies include vaccination, meningococcal vaccine, pneumococcal vaccine, and Haemophilus influenza type B vaccine. Prophylactic antibiotics for close contacts, good hygiene practices like hand washing and avoiding shared utensils, prompt treatment of ear or sinus infections to prevent spread. Who is most at risk? Infants and young children, elderly individuals, people with weakened immune systems, students in dormitories or military recruits, and travelers to regions with high rates of meningococcal disease. Vaccination campaigns and education are vital for protecting these groups. The World Health Organization supports global initiatives to prevent and manage meningitis, including the Defeating Meningitis by 2030 roadmap. This involves improving surveillance, increasing the vaccine access, strengthening healthcare systems, and educating communities worldwide. A combined approach, public health, clinical care, and community action is the only way to control and ultimately eliminate this deadly disease. Let's summarize. Meningitis is the inflammation of the membranes around the brain and spinal cord. Bacterial meningitis is a medical emergency requiring immediate care. Symptoms include fever, headache, neck stiffness, and neurological signs. Complications can be severe, but early treatment can save lives. Prevention through vaccination and hygiene is our strongest defense. Meningitis does not always give you time to wait. Recognizing symptoms early and acting fast can be the difference between life and death. If you or someone you know experiences these signs, seek emergency care immediately. That's it for today. Thank you for watching. If you found this video helpful, please like, share, and subscribe to MedClarity for more reliable and expert medical content. Stay safe, stay informed. I will see you in the next lesson.